Hello, everyone. This is Joe here with Joe Talks. And today we are going to talk a little bit about insurance plans and insurance elections. And so these would be the insurance plans that you would pick every year during open enrollment that your employer offers. And, you get those plans where you've got the gold, the silver, the bronze, you've got health savings account, high deductible, low premium accounts. Sometimes it's difficult to figure out which one of those you want to pick and which one best suits you and your family. And so today we're going to look at a few things that you can evaluate to help you kind of determine which one of those you should pick. So before we get started, I want to disclose I'm not a financial advisor by any means. This is just the system that I kind of use every year, and I thought it might help some people out there. But if any of this is confusing to you, or you are kind of unsure of any of this stuff, by all means, go consult a professional to get some help. But anyway, and again, as always, before we get started, if this video or content helps you, please help me out. Like, subscribe, all that good stuff you hear on all the videos out there. So with that said, let's dive into this and take a look at some of these numbers. So one of the things I want to talk about is the different types of plans we have. So I went out on the internet and I found some sample plans, and I want to describe those before we get started. And so the plans that I found have a gold plan, a silver plan, and a bronze plan. And the gold plan is what you might consider kind of that top tier plan. This is the really high premium, low deductible plan. And then in the mid-range, there's the silver plan, and then on the lower end of that is the bronze plan. And so if we look at some of the details of that gold plan, now I'm not using actual numbers that I found. I kind of rounded some of these numbers just to kind of respect the business's privacies, but I think some of these numbers that you're going to see are going to be pretty close to what you're going to find when you go to work for an employer. And so this gold plan is a $900 deductible with a $750 a month premium. And so all of these plans are going to be for hypothetically a family of four, right? So 2 adults, 2 children. Obviously, there's other plans for employee only, employee plus child, or employee plus children. But we're going to stick with the that basic family of 4 scenario. And then keep in mind there's also scenarios here where you have in-network and out-of-network. So everything we're going to look at today is going to be assuming that all of our medical expenses are in-network. So that gold plan, as I said, has a $900 deductible with a $750 premium. The silver plan is a $3,000 deductible with a $450 a month premium, and then the bronze plan has a $4,000 deductible with a $325 a month premium. And when we talk about these deductibles, we need to do a little bit of deep diving here and talk about the difference between an embedded deductible and an aggregate deductible. So both the gold and the silver plans have what are called embedded deductibles, whereas the bronze plan has an aggregate deductible. So let me read to you the description of those two, and that way we have a better understanding of what those are. So with an embedded deductible, the description is the medical plans have an embedded deductible. With an embedded approach, each person only needs to meet the individual deductible before the plan begins paying its share for that individual. And once 3 or more family members meet the family limits, the plan begins paying its share for all of the covered family members. So basically that means each person in the family kind of has their own deductible. And so, for example, on the gold plan, it has a $900 overall deductible, but the individual deductible is $300. So say, for example, the dad in the family goes and has a surgery, and say that surgery is $10,000. Well, the dad's deductible would be $300, and then the co-insurance would kick in after the $300. And so I didn't mention the coinsurance when I was giving the description. For the gold plan, it has a coinsurance of 25%, while the silver and the bronze both have 30%. So that means once your deductible is met, you're going to pay 25% of your medical bills, and then insurance will pay the other 75%. And so the gold and the silver both have the embedded plan, while the bronze plan has an aggregate deductible. So let's take a look at what the aggregate deductible is. With an aggregate approach, one family limit applies to everyone. When one or a combination of its family members has expenses that meet the family deductible, it is considered to be met for all of you in the family. Then the plan will begin paying its share of the eligible expenses for the whole family for the rest of the year. What that means is only one member of the family needs to meet that deductible, and then the entire family is covered under the insurance. As compared to the embedded approach, you might have one family member that's met their individual deductible, and then coinsurance kicks in, while another family member may still have to meet their individual deductible before coinsurance starts to kick in for that individual family member. So with the embedded approach, the insurance is kind of more individual for each of the family members, whereas with the aggregate, it's kind of, you're looking at the family as a whole. Okay, so now that we have a better understanding of what each of the insurance plans are, let's go take a look at a hypothetical situation and look at how we can try to predict what our expenses are going to be with each one of these policies. So what we have here is a hypothetical situation looking at what our overall medical bills are. So what I have over here in column A is what we might expect our bills to be. So, and this is the adjusted bill. So this is not the overall bill that the hospital gives you. This is the negotiated bill that the insurance company negotiates down, and this is what you would see as a final expense on whatever your medical bill is. And so what we have here in each one of these rows in column A is hypothetically, say for example, you only had $100 annual expense, or $200 or $300, and so on and so forth. And then in these coinsurance columns, we're evaluating how much of that bill is going to be coinsurance that you're going to be responsible for. And then over here in columns F, G, and H, we're looking at what our actual out-of-pocket cost for the year would be for each one of these hypothetical situations. And so that out-of-pocket expense is going to be your premium, your deductible, plus your coinsurance, depending on how much your overall medical expense is. And so as we see in these coinsurance columns, you'll notice with $100 expense, that's all going to be deductible, $200, $300, and so on and so forth. Now, I also want to point out in these scenarios we're going to look at, with that embedded approach where you have each individual with their own deductible, you kind of have to look at two different scenarios. You have to look at one scenario where maybe one member of the family is responsible for all of the medical expense. So maybe the mom or dad had a major medical procedure that was $30,000 or $40,000, and that was the chunk of your annual medical expense. And then the next scenario we're going to look at in a few minutes is, what if that expense was spread out across all of the family members? And so in that situation, we'll assume that all three members of the family met their deductible. And so in this example, what we're looking at is we're kind of assuming that one person in the family was responsible for all that medical, and that's why in this scenario we have a lower deductible, that individual deductible of $300 for the gold plan, $1,000 for the silver plan, and then with the bronze, that's an aggregate. So regardless if it's one person with all the bills or it's shared, the family as a whole has that $4,000 deductible. So what we're going to do is we're going to look at a chart here, and we are going to look at the overall expense for what you might expect to have for the year versus your out-of-pocket expense, again being premium, deductible, and coinsurance. And what we want to look at is where these lines cross. So I've got these color-coded here. So this is the gold plan, the silver plan, and then that orange-looking one is the bronze plan. And one thing we'll notice is in order for that, what we might consider upper tier, that premium plan, that gold plan, to be cost effective, as compared to the bronze plan, you have to spend almost $50,000 for the year for that upper end expensive plan to pay off. If we compare that to the silver plan, it's upwards of $60,000, right? So, if you're just kind of looking at these plans just at a high level, you might think, oh, that low deductible, that's what you want. Well, in reality, your total out-of-pocket expense is going to be higher with that plan depending on how much you spend throughout the year. So in order for that to pay off, you really have to have quite a bit of medical expense throughout the year for that to pay off and have a total out-of-pocket expense less than those other two lower tier plans. So if we want to get a more precise number of where those breakover points are, we can come in here and look at the actual numbers. If we scroll down here, we'll see that when we look at that gold plan compared to the bronze plan, we can see where those numbers start to cross over, where the gold plan becomes cheaper than that bronze plan, and you have to spend $50,600 for that to pay off. When we go down here and we look at the silver plan to the gold plan, again, $62,600 is what you have to have in medical expenses for the whole year for that gold plan to pay off. So keep that in mind when you're looking at these policies. That $300 deductible looks really attractive, but when you factor in how much premium you're going to pay for the year, you're paying over $9,000 a year in premiums for that gold plan compared to $5,400 for the silver and $3,900 for the bronze. So that's quite a bit of difference in premiums for just for that little bit of drop in your deductible. But when you look at the overall expenses and how much your out of pocket is going to be, that gold plan is really not quite as attractive as it looks when you're just kind of perusing the plans on your election sheet. So let's go over now and look at that other scenario where we have kind of multiple sources, where that embedded deductible is kind of spread out amongst all of the family members. So we have the same scenario here, but except in this situation, I have bumped the deductible up for the gold to the $900 and for the silver to the $3,000. So that assumes we've met the deductible for the whole family. Again, with the bronze, it's still just the $4,000. And if we go look at that chart, we see that for the gold to be beneficial to compared to the silver, we're at about $43,000. Whereas the bronze compared to the gold is upwards of about $59,000. So, you really have to look at, what do you expect your expenses to be? Do you expect all of the members to hit their deductible? Well, then looks like that bronze plan would actually be the better one, unless you're going to have more than $60,000 in medical expenses. And so, you really have to think about that. And if you have a couple of surgeries coming up or something, or maybe the mom or the parents both have some pretty major surgeries coming down the line, maybe that gold plan is going to be better. But really, if you think about it, once your insurance company kind of negotiates that price down, there aren't a lot of surgeries that are more than 20 grand, especially if it's an outpatient type surgery, unless you're getting into like heart surgery, those types of things. Obviously at that point the gold plan is going to be way more beneficial. But you really have to take these into account. Now, the other thing we want to talk about is that that bronze plan is considered that high deductible, low premium plan, and that qualifies you for a health savings account. And so, your health savings account is a tax deferred account you can put money into, and you keep that money year over the year. So, ideally, you would, if you're going with that bronze plan, you'd get that low premium, but don't just go waste that extra money. You should really try to max out that HSA plan, and then year over year, you let that HSA plan build, because there'll be some years you don't use all that balance. There may be others that you do, but the ideal with that is over time, that account balance will grow. And plus, the other thing you have to think about is, all that money that you put in that HSA, well, that's tax deferred. Well, depending on where you're at on the tax bracket, if your upper tier tax bracket is in the 20-ish% range, well, every dollar you put in that HSA gets lobbed off at the end of your income balance. And so basically that's like getting a 20% discount on anything you pay towards medical. So you kind of have to keep that in mind. The numbers we're looking at here, these are assuming you're paying full price, but in reality, you could look at these expenses right here, and depending on what your HSA balance is, the max HSA annual is $8,300. So really, up to, for the first $8,300 worth of expenses that you have, it's all tax free. So kind of have to keep that in mind. Really, I shouldn't be looking at this column. Over here, this is premiums. But over here, if we look at columns J, K, and L, this is actually where I take the premiums out. So this would be what you actually pay just in deductible and coinsurance. So if we go down here to $8,300, let's say you're in your first year contributing to your HSA. Well, for the first $18,000 worth of medical expenses, it's like getting a 20% discount, basically, because that 20% that you're saving on tax that you would have paid to taxes, you can now put towards medical expenses. So anyway, that's what I have here. The key thing here is just don't just look at these plans and think, oh, well, low deductible is good, or that's going to save me money. You really have to take everything into account: your premiums, your deductible, and your coinsurance. That coinsurance is what kills you. And so look at all those things, chart those out. Now, there's some other details about these plans that might come into play. With the gold and the silver, you've got co-pays for office visits and things of that nature, urgent care. Whereas with the bronze plan, all of that goes towards your deductible. So take that into account too. What do you have? Small children? Are you going to be making a lot of visits to the pediatrics office? Maybe you want that copay instead of the deductible. But at the end of the day, don't just throw the darts and pick a plan. Really sit down, do an analysis of what you think's going to happen with your family. I know it's hard to predict what's going to happen. None of us has a crystal ball, but you can at least kind of estimate what you think might happen, and then pick the plan that's best for you, and then get the biggest bang for the buck. So anyway, I hope this helped. And again, if you like this or you found this beneficial, please help me out. Like, subscribe. I'm really trying to build my subscriber count, grow my channel. So help me out. It doesn't cost you anything. It helps me a ton. So anyway, that's all I have. And until the next one, all right. Thank you.